Thyroid and root of the neck. Grant's Dissector, 14th edition, pages 195 through 199. 15th edition, pages 215 through 218. Here are the objectives for today. First of all, we want to see if we can locate and describe the specific features of the thyroid gland and see if you have one of these little interesting thyroidea arteries. Then we're going to review the arrangement and distribution of the cervical sympathetic trunk. What is its function? Think back to the first lecture that we had on the autonomic nervous system. Then let's review the carotid sheath and its contents. We should have seen that in the last lab on the anterior triangle of the neck. And then last but not least, let's identify and trace and also describe the general functions of cranial nerves number 10, the vagus, number 11, the spinal accessory, and number 12, the hypoglossal nerve, and also, not to forget, the phrenic nerve. Starting off with the thyroid gland, you should be able to appreciate that it has two lobes, a right and a left lobe, which are connected in the middle via a structure called the isthmus. We're going to take our scalpels and cut the isthmus so that we can then actually open up the thyroid gland and kind of reflect laterally the lobes. And in doing so, have a look and see if you might have one of these special lobes called the pyramidal lobe. When you've folded open the thyroid gland to the right and left sides, let's have a look at the cross section here. That's easy to appreciate this like this. You should be able to find your recurrent laryngeal nerves. Remember that the vagus nerves, once they've actually gone inferiorly, they will both split off, albeit at different levels. A recurrent nerve, so you'll find a right recurrent laryngeal nerve and a left recurrent laryngeal nerves. You should be able to locate them once you've actually opened up your thyroid gland. Those nerves should actually be posterior to the lobes of the thyroid gland in a little groove that lies between the trachea and the esophagus. And once you've done this, you can go ahead and remove the left lobe. So what you're going to have to do is you're going to have to cut all the blood vessels that are leading to the left lobe of the thyroid gland. Then you can cut it out and see if you can identify some of these parathyroid glands on its posterior surface. The parathyroid glands are actually really small. They're only about 5 millimeters in diameter, and they could be a little darker in color than the thyroid gland itself. Now remember that these glands, although they're very small, they're absolutely essential to life. Usually you're going to have about 2 of those parathyroid glands, but this number is variable. It can be anything between 1 and 3 usually. Because the thyroid gland is a very, very active endocrine gland, it has to have a rich arterial supply, and we've seen at least one of these arteries already. The arterial supply here is coming from the superior thyroid artery, but we also have a supply from the inferior aspect via the inferior thyroid artery. Please note here that the superior thyroid artery comes from the ECA and the inferior thyroid artery comes from the thyrocervical trunk. And in addition to these arteries, you might also find one of these little arteries in the midline called the thyroid artery. This here can sometimes lead to problems if you have to have a surgical resection of the thyroid gland. If this artery is cut, of course it will lead to profuse bleeding, so that's why it's important that the surgeon is aware of the possibility that this artery might be there. There are 3 pairs of veins that drain the thyroid gland. You have superior and middle thyroid veins that will drain into the IJV, and you have inferior thyroid veins that will drain into the respective left and right brachiocephalic veins. In this photo from one of the cadaveric atlases, you can see your thyroid gland here in the middle, and you can also see inferior thyroid veins, and also nicely depicted here is the recurrent laryngeal nerves on the left and on the right sides. Now moving on to the root of the neck. This area is actually quite important because it lies superior to this region called the superior thoracic aperture. So basically all structures that will pass between the head and the thorax will have to pass through this junction here. In the dissection we're going to proceed as follows. First we're going to study and dissect the branches of the subclavian artery, and then we're going to have a look at the course of the vagus and the phrenic nerves. Important here to remember the relationships that these nerves have to each other, which one is more lateral, which one is more medial, where do they branch if they do branch, and are there any muscles that we can use as landmarks. For instance here, the anterior scalene muscle. When you come to lab for this dissection, we will make sure that the clavicles that would otherwise be in the way and be a hindrance have already been removed, so that we can then proceed with our dissection. And we will start off by having a look at the subclavian artery and at its different branches. If you still have one, and I know it's not in this picture, you should follow your external jugular vein inferiorly until you can see how it passes through the investing layer of deep cervical fascia, and that will be pretty close to where the clavicle has been. The most important thing here to note would be that the external jugular vein is the only tributary to the subclavian vein. The other instructions for the veins, so for the subclavian vein, internal jugular vein, brachiocephalic vein, vertebral vein, these are all in the dissector. In the 15th edition, this starts on page 216, continues on 217. Now let's turn our attention towards the arteries, specifically towards the three parts of the subclavian artery. Okay, so you have the first part here, which reaches from the origin of the subclavian artery up to the medial border of the anterior scalene muscle. Then you have the second part, which is posterior to the anterior scalene muscle, and then you have the third part, which is right in between the lateral border here of the anterior scalene muscle and the lateral border of the first rib. The first part of the subclavian artery has three branches. First of all, the vertebral artery, which ascends through the transverse foramina of the cervical vertebrae, starting at vertebrae C6. Then the thyrocervical trunk, which in itself has several branches, and the internal thoracic artery that supplies the anterior chest wall. The branches of the thyrocervical trunk are as follows. You have the transverse cervical artery, which heads posteriorly towards the trapezius. Then you have the suprascapular artery, which passes laterally and posteriorly to the region of the suprascapular notch, and it'll supply some of the muscles of the back. Then we have the inferior thyroid artery. The inferior thyroid artery we have previously discussed, that goes upwards, it ascends and supplies the inferior pole of the thyroid gland. And most of the time you also have splitting off of the inferior thyroid artery this little artery here, which is called the ascending cervical artery, which rises upwards kind of parallel to the course of the vertebral artery, only not through these transverse foramina. The second part of our subclavian artery only has one branch, and this is called the costocervical trunk. The costocervical trunk itself divides again into two other arteries, which would be the deep cervical artery and the supreme intercostal artery. The supreme intercostal artery in itself then gives rise to two other arteries, which would be posterior intercostal arteries, the first and the second posterior intercostal artery. And the third part of the subclavian artery only has one branch, which is the dorsal scapular artery. This artery is quite easy to recognize, at least most of the time, because it will usually pass between the superior and middle trunks of the brachial plexus. Remember, the brachial plexus will appear between the anterior and middle scalene muscles. Okay? But there is, of course, an exception to the rule here for the course of the artery. In about 30% of the cases, this artery will arise from the transverse cervical artery and not from the subclavian artery. Now let's see if we can find one or both of our lymphatic ducts, so either on the right side. See if you can find the right lymphatic duct at the junction of the right subclavian vein with the right internal jugular vein, or the thoracic duct as it's called at the left venous angle at the junction of the internal jugular vein on the left side and the left brachiocephalic vein. Then on both sides of the neck we should be able to find and identify within the carotid sheaths our vagus nerves. Here's the vagus nerve on the right side. It's been then cut in this image. And also let's make sure that we can identify the recurrent laryngeal nerves. Here is the left recurrent laryngeal nerve, and here is the right recurrent laryngeal nerve. An important note here is that the right recurrent laryngeal nerve will actually loop around the subclavian artery and then lie medially here. The left recurrent laryngeal nerve actually loops around the aortic arch, so much lower down. We will not see that in lab, but they then both come to lie pretty close to the midline here, left and right of the esophagus, in this little groove between the trachea and the esophagus. And then once again, make sure you can see your phrenic nerves, and you have as an identifying feature, of course, here the anterior scalene muscle on both sides. And you remember the mnemonic: C3, C4, C5 keeps the diaphragm alive. So those are the roots that contribute to your phrenic nerve. And while we're here in the neck, go ahead and see if you can identify the cervical portion of your sympathetic trunk. You might be able to find a little ganglion here, which is either called the inferior cervical or also called the stellate ganglion, because it's kind of shaped a little bit like a star. And last but not least, use blunt dissection to clean the roots of the brachial plexus at the level of the interscalene triangle. So interscalene triangle, it's a triangle between the anterior and middle scalene and the first rib here. Okay, and you should be able to identify those parts of the supraclavicular portion of the brachial plexus, so that is all of the brachial plexus that is superior to the clavicle, so above the clavicle, which would be in that case 5 roots, 3 trunks, and 6 divisions. Okay. Here's a video link to the University of Wisconsin for the dissection of the deep neck. This covers quite a lot of the structures that we are dealing with in today's lab, and it'll also review some of the ones that we've already had. And then in addition to that, of course, there are always the Ackland videos about the head and neck that you can watch either in the library or from your computer if you log in with your Blazor ID through Lister Hill Library. The review slide, many of these structures should be quite familiar now. We have, for instance, here the hypoglossal nerve. We have the vagus nerve traveling within the carotid sheath. We have the scalene muscles, the anterior and the middle scalene, and further back the posterior scalene. And you can see coming in between them the brachial plexus. And crossing over the anterior border here is the phrenic nerve, so over the anterior border of the anterior scalene. And in addition to that, here's our omohyoid, the superior and the inferior belly. Here are some of our supraclavicular nerves, and our submandibular gland, our facial artery, curling over the ramus of the mandible, and back here is the spinal accessory nerve. The big muscle back here is your semispinalis capitis, and back here is the trapezius muscle. Here the clavicle and the chest plate have been removed, so you can really nicely see not only the brachial plexus, so the roots and trunks of the brachial plexus, but you can also see the vagus nerves on the right and on the left side, and then laterally to it, this is how we like it, the phrenic nerve. And you can see the phrenic nerve on both sides descends all the way down here, because we know where it's going to go. It's going to go all the way down to the diaphragm. And again, our reliable landmark muscle here is the anterior scalene, both for the phrenic, but also here medially for the vagus, and of course in between the anterior and the middle scalene, here are the roots of the brachial plexus. In this lateral view of a deep dissection of the neck and the root of the neck, we can see here the clavicle has been cut on the right side, and we can also appreciate, which is highlighted in yellow here, the vagus nerve and the phrenic nerve. The phrenic nerve, of course, running lateral to the vagus nerve. Both of them are coursing inferiorly. In addition to that, here's our subclavian artery, and we can see one of the branches coming off here, the internal thoracic artery, and we can also see the roots of the brachial plexus here coming right out in between the middle scalene and the anterior scalene muscle that has been removed, so that we have a better view on these.